These are the four most common types of pigmentation and how you can treat them. So starting off with freckles, these are a genetic pigmentation condition. They're generally brought out by the sun and they're very hard to get rid of long term because it's just your skin's way of responding to the sun basically. You can have medium depth peels and IPL to help to reduce them, but you will have to continue to have those treatments long term. Next up is post-inflammatory hyperpigmentation. This is caused by trauma to the skin and is very common in darker skin types. It can fade on its own over time, but generally using a combination of peels, high dose retinols and pigment regulators as well as a high factor SPF will help to reduce these faster. Then we have sun damage, extremely common, and obviously it's caused by sun exposure. It must be managed long term. You can't continue to go in the sun and have treatment for this. It will get worse if it's left. And again, the best control for this long term is peels, high factor SPF, and pigment regulators. And finally, we have melasma, notoriously the hardest pigmentation to get rid of. It's usually caused by hormones or sun damage. It's very, very common during and after pregnancy. And generally, you will need a much deeper chemical peel for this, something like Cosmolan, to help to remove the pigment and keep it controlled long term.